Hello, and welcome to the program Worker Wellbeing During COVID, Lessons Learned. My name is Jane Kim, and I'm the Dean for Academic Affairs at the Harvard T.H. Chan School of Public Health. Thank you all for joining us for this timely and important conversation. In March 2020, the COVID-19 pandemic upended most of our lives. At the Harvard Chan School, we launched nearly 600 research projects on the virus, especially in the areas of epidemiology, health disparities, and mental illness. Mental health has long received limited attention, but with the pandemic, conversations about worker well-being and concerns about high levels of distress have been moved to front and center throughout the nation. The pandemic is teaching us many lessons about how to create resilient organizations that will enable worker well-being in the face of serious disruptions. These are lessons that will apply well beyond the pandemic. For over 5 years, the Harvard Chan School's Lee Kum Sheung Center for Health and Happiness has applied academic rigor to the study of happiness, well-being, and resilience. The center has become a leader in the field and is well situated to help address this topic. It is now my pleasure to turn the program over to the center's co-director, Vish Viswanath, to introduce today's topic and our moderator.
Thank you, Dean Kim. Good morning, everyone. Thank you so much for joining us today. Let me first start by thanking the Lee Kum Sheung family for their foresight and generosity to launch the Lee Kum Sheung Center for Health and Happiness at the Harvard Chan School. Their longstanding commitment to promoting well-being led to the creation of this center to better understand the relationship between positive outlook, positive social environments, and physical health. Like me, I'm sure many of you have had conversations recently with family, friends, and co-workers speculating about what work might look like as we navigate out of the pandemic. As we do, what are the challenges and opportunities that we may experience if we are trying to foster workplace well-being among workers? Given many of us spend a third of our work days, our days at work, how do we spend that time? And what we do affects our health and well-being. We have been examining what contributes to employees' mental health and resilience, and how workplace policies and cultures can contribute to or erode worker well-being. Workplaces range widely in terms of racial, ethnic, and socioeconomic diversity. So any policies affecting workers, particularly in relation to the pandemic, should take this diversity into consideration. The pandemic is an extreme example of a disruption to work and life. This needs to be recognized by workers, management, and policymakers. Today, we will be speaking to two people who have either studied or managed frontline workers who have been working through the pandemic. We will be examining lessons learned in their experiences over the last 16 months related to worker well-being and resilience. Our moderator today is my colleague and friend, Dr. Howard Koh. Dr. Koh is the Harvey Fineberg Professor of Practice of Public Health, Leadership at the Harvard T.H. Chan School of Public Health, and the Harvard Kennedy School. He's also the faculty co-chair for the Harvard Advanced Leadership Initiative. He leads the Robert Wood Johnson Foundation's grant, a project on making a culture of health a business imperative. In addition, he's a member of the Scientific Advisory Board for the Center for Health and Happiness. I will now pass on the mic to Dr. Koh. Dr. Koh?
Vish, thank you so much and welcome everybody. It's such a great honor to be asked to moderate this very important panel about issues that are of critical importance to well-being and public health around the country right now. First of all, let me thank the leadership of Dean Jane Kim, our academic dean at the Harvard Chan School of Public Health. Her leadership through the pandemic up to the present time has been invaluable, and her presence today speaks volumes. So Jane, thank you so much for being here. And it's always good to join my good good friend and longtime colleague, Professor Vish Viswanath. Vish and I have worked together on so many collaborations over the years on the Robert Wood Johnson Culture of Health Grant, joining private business and public health, as he mentioned, on community-based health disparities in Massachusetts and nationally, on emergency preparedness and vaccinations, on India projects. And now, as he mentioned, I have the pleasure of serving on his advisory board for the Center of Health and Happiness, which is co-directed by Professor Laura Kubzansky. But today I want to particularly welcome all of you who are tuning in to learn more about worker well-being and resilience during COVID-19 and beyond. And it's really important, especially to see how these themes play out in traditionally underserved communities. So today I'm very delighted to welcome two distinguished panelists. They'll be speaking, and then I'll be asking some questions, and then we'll be inviting questions from all of you. So please submit your questions directly to the Zoom Q&A box. So our two distinguished panelists are, first, Laura Kubzansky. She's the Lee Kum Sheung Professor of Social and Behavioral Sciences at the Harvard Chan School of Public Health. And as has been mentioned, she also serves as co-director of the Lee Kum Sheung Center for Health and Happiness. And then our second distinguished panelist is Mr. Jonathan Isaacson. He's the CEO of the GEM Group in Lawrence, Massachusetts. The GEM Group provides branded products to the promotional products industry. And I've had the pleasure of hearing him speak previously about his commitment to business and public health in Lawrence through work that Vish and I have been involved in over the years. So we're going to ask each of our panelists to speak for about 7-8 minutes, and then we'll move on to questions. So to start, Laura, can you please tell us about your research in this area and the work you've been doing studying worker well-being through the pandemic and beyond?
Sure, thank you. It's a pleasure to be here, and I'm happy to have an opportunity to speak about some of this research and also to hear some of the conversation with Jonathan, his experience sort of actually implementing a lot of these ideas. So the research I'm going to be speaking about is work that we actually began prior to the pandemic. We were interested in how workplaces could foster worker well-being. And we decided that we were particularly interested in low-wage hourly workers. We felt like this was an area where we know much less about in terms of what enables people to do well at their workplaces. And so we were interested in actually speaking with the workers to get a sense from them, because the research in this area has been relatively limited, to really hear from workers what works for them, what aspects of the workplace help them to have greater well-being. We had been out in the field. We had been doing a whole range of interviews with workers in 3 different industries. We were speaking with workers in retail, and I'll come back to a little bit more detail about these folks, in warehouse and in healthcare. And then the pandemic hit, and we thought, well, this is a really interesting opportunity to do some before and after, to kind of hear from people what kinds of practices did their workplaces implement that made it possible for them to continue working through the pandemic. These are all what we would consider frontline workers. So none of them were able to work from home. They all had to continue to go into work. We just thought this was a really interesting opportunity to hear about what kinds of things facilitated resilience, both for the workers and for their organizations. So I want to say a very big thank you to the Robert Wood Johnson Foundation. This is the organization that supported this work, so we couldn't have done it without that support, the financial support. And also, this is research that was done in collaboration with some other folks from the T.H. Chan School, Dr. Lisa Berkman, and then also with collaborators at the MIT Sloan School with Dr. Erin Kelly. So I want to recognize my partners in this work. So as I said, we were interested in the factors that foster worker well-being, as well as resilience. We were interested in who does well and why. And we were particularly struck by the fact that we think there are aspects of the environment and the workplace that make it possible for people to do well, that resilience and well-being are not necessarily so much an attribute of the individual, but these are experiences that are fostered by what's happening in the environment and in the workplace. And so that we shouldn't be, looking at each individual and saying, why are you doing well? Why aren't you doing well necessarily one by one, but kind of looking at the structure of the environment around them to say, what are the factors in the environment that make it possible for people to do well, or that make it hard for your workers to do well? And then relatedly, the organization will have trouble, right? It will be tough to keep the organization doing well when the workers aren't doing well and maybe they're leaving or they don't feel safe or something like that. So we were really interested in hearing from workers having these experiences. What were the aspects of the work environment that they felt were really helpful and aspects that maybe were less helpful? Just a little more detail on who we were speaking with. We were working with folks in retail. So these were associates who were working in sales, customer service, inventory, and their supervisors and salaried managers. And they were located in 2 Massachusetts-based stores and a national retailer. And these organizations, when the pandemic hit, did an initial shutdown and then they came back. So they did have some time to kind of think about how they were going to manage the exigencies of the pandemic. We were also speaking with associates and their supervisors who were working in 4 warehouse fulfillment centers of a large national retailer. And these associates are involved in things like picking merchandise and receiving, packing and shipping orders. They had a really big uptick in business at the very start of the pandemic, and then things dropped off pretty dramatically. So there was almost really no time to kind of they were figuring stuff out kind of on the fly. And then we were also speaking with nursing assistants, so either CNAs, certified nursing assistants, or patient care technicians in 2 different hospitals. One was a more urban hospital, one was a more rural hospital. And we were also speaking with their nurse managers. And these were based in both Massachusetts and Connecticut. And these folks that we were talking to are people who are involved with basic patient care activities, things like bathing, feeding, grooming, taking medications and vital signs. They were heavily involved with COVID testing during this time. And of course, the hospitals had no time to shut down when the pandemic hit. They were also trying to figure things out on the fly. One last thing I want to mention, and then I'll hand it off to Jonathan, is the term resilience gets used a lot. And I think we're going to talk about it a lot today. And I just think it might be useful to define what we mean by that term. It is sometimes defined as being able to bounce back after facing adversity. But this definition doesn't always work because where you bounce back to might depend on where you started. So if you started in a bad place, it's not clear you want to bounce back to that bad place. Or if there's been very dramatic change, you may not be able to get back to wherever you started, right? So what's helpful to think about perhaps more so is having resilience is about having the flexibility to change and adapt through challenges. So that maybe you can even, some people talk about bouncing forward, or you could get to an even better place than you were before the adversity and the disruption happened. And this can be for both people and for their organizations. So I just like to kind of put that out there. And I will say that the center has a whole range of resources for thinking about resilience, articles on resilience, ways to measure it on our website, and we'll put that in the chat. So if people are interested to take a closer look at that, there's also some seminars that we've done on resilience if this is something people want to look at more carefully. And with that, I will hand it back to Howard and go from there.
Laura, thank you. That sounds fascinating and cutting edge. So we look forward to hearing more about results and your thoughts and reactions to what you found. It's fascinating to hear that you connected directly to people in the front line, essential workers, and many others in key industries during a critical time. So let's switch now to Mr. Isaacson. Jonathan, it's good to see you again. Please tell all of us about your company. You might also want to tell us more about Lawrence, Massachusetts, for those who don't know. Tell us what your company does, how many workers you employ, what type of work they did and you did during the pandemic in the context of Lawrence, Massachusetts.
Well, thank you for having me. It was certainly a very interesting, I guess, exciting time might be a word for it. I hope it was a once in a lifetime time. I am the CEO and chair of the GEM Group, and we make promotional merchandise, stuff with logos on it. We have generally between 400 and 500 people in a facility here in Lawrence, Massachusetts, which is north of Boston, about half hourly, half administrative. And we sell our own products plus a bunch of brands that people know that we bring to market, such as Moleskine, Samsonite, Sharpie. There's a lot of them. And we are one of the larger employers in the community. I'll tell you a little bit about the community, but before I do that, the company itself has always been involved in the community in some way. And we've talked about that in past sessions, but this is the community in which a lot of our associates live. And so we've always felt it important to be involved in the community and the community institutions. I sat on the board of the local community hospital. I sit on the board of the local economic development group, and I actually ran for them their COVID-19 task force, which was an interesting view into what's going on. And I'm also involved in a number of businesses locally, nationally, internationally, where I was talking to a lot of other CEOs about what was going on in their businesses and their communities. So I had a pretty interesting view of what was going on and how people were reacting to COVID here and around the world, frankly. Lawrence is a mill town, a former mill town, I guess, located north of Boston. It's a gateway community with a fair amount of poverty and all the problems that come with being a gateway community. It's 80 or 90% Latinx, primarily Dominican. And during COVID, we had one of the highest positivity rates in the state. And there were a lot of reasons for that, which I don't know if we're getting into today. Our workforce, the hourly workforce that we have primarily comes from Lawrence and the surrounding areas. For the white collar workforce, and there's a huge range of education levels from really functionally illiterate, literally, to advanced degrees that are sitting in the building here today. But people come from a lot of surrounding communities, and our claim to fame in a lot of ways is upskilling, taking people without a lot of skills, bring them in. And when I say a lot of skills, maybe not even English, training them, and you end up with somebody who can run 75 people on 2 shifts quite well, and somebody who understands what it's like to be that person on the line. And that's something that, frankly, we lost a little bit during the pandemic, and we're trying to put that train back on the tracks. During the pandemic, I received a call from one of the big Boston teaching hospitals who was desperate for PPE, and they called us because we have a reputation for trust and delivering what we promised. We deal with a lot of big organizations around the country, and we essentially jumped into the PPE business. It was highly stressful, frankly. We ended up donating to hospitals. That was not a profit center, but we ended up selling a lot to senior living centers around the country who were in a real critical emergency because they had no PPE. It was very stressful, a very stressful time. Something was always blowing up during that time, and there were an enormous amount of bad actors that had gotten into the space very, very quickly. But we delivered tens of millions of units without one return for not meeting a spec. And we did that by putting together a standard of care committee, which was an epidemiologist, an industrial hygienist, which I know started at the Chan School, that field of study. I didn't know what one was before we found one to help us, and a microbiologist. It helped us keep the facility safe and to design the product. We had shut down the facility for 2 weeks, and then we were open again, and we were running straight through the pandemic. Lots of questions about who should come in, whether I should come in, whether the senior staff should come in. There was a lot we didn't know at that time. But we had 0 transmission in our facility, 0. And we had almost a full-time contact tracer here. We were the master of the shower curtain, the clear shower curtain that we used to separate people at workstations, which was a great idea from the industrial hygienist. And it was quite an interesting run. As a side note, you had to get permission from the state to be an essential business and to open up. There's an email that you can send it to, and I'm still waiting for my reply from the state as to whether we're able to open up as an essential business. And at this point now, we are still running. We're 86% vaccinated, which is a whole nother story within our facility, and that's both hourly and white collar. And we're now dealing with a global supply chain that is completely and utterly broken. But here I am doing panels at famous schools of public health. And that was our story during the pandemic. So I turn it back to you.
Wow, Jonathan, this is a fascinating introductory set of comments from you. Thank you so much. We could spend a couple hours just delving into all this. And so we're going to try to hit the high points as we go forward. And what's fascinating to me is through the pandemic, we saw a lot of businesses around the country pivot to make PPE, to make masks, to help make soap and cleansing products. And you saw the auto industry making ventilators, actually, some of that through the Defense Production Act that was announced by national leaders. So you see a pivot going on in lots of businesses through COVID. And the fact, Jonathan, you had to do that in a very underserved community during a once in a century crisis is pretty astonishing. So thank you for that fascinating report. So let's move on now. You've both sort of told us about the backdrop and the context, but looking back and looking forward, what worked well and what didn't in enabling workers to continue to do their jobs through the pandemic? And Laura, you want to start, and then Jonathan can come next?
Sure. I mean, I think not surprisingly, one of the biggest issues that workers mentioned, and when we asked them about, what was helping with well-being in this period, was they needed to feel safe. So what it took to feel safe differed in the different industries, right? So in retail and warehousing, workers actually, interestingly, felt relatively safe. They felt like their organizations jumped on sort of thinking about what it was going to take in terms of, social distancing and masking, as well as, separators and, Jonathan's point about, shower curtains and sort of all the different kinds of equipment that people brought into play. And in the retail setting, they did things like, contact tracing with folks in store, offering curbside pickup. So a lot of the things that we're all familiar with on a consumer side. And so, for the retail and warehouse folks, feeling safe in terms of COVID, interestingly, like we found that the workers we spoke to, that was not a huge issue for them. I'll come back to issues that were bigger for them. The healthcare workers, of course, had a much bigger issue with feeling safe at work. And I would say that took a much longer time before they felt like it was safe to go in. And that was definitely really disconcerting. There were these hourly changes in sort of the recommendations and the guidelines of what they were supposed to be doing in order to stay safe. And that created just an enormously chaotic and anxiety-provoking environment. So there were a number of things that we heard from the workers that helped a little bit with that front, and different settings did it a little better or worse. I want to just come back to what the retail and warehouse workers needed to feel safe was was related to economic precarity. And so what they found was that for the organizations that did furloughs rather than layoffs, that really helped with them feeling safer. But the real challenge was economic precarity rather than a sense of health concerns. Like they were okay to go into work, but of course their work hours were enormously disrupted, and a lot of drop off actually in the hours that they were given. In the retail organization, one of the things they did was they tried to give more hours to the full-time workers, and they really cut or completely dropped the part-time workers. And that was really, sort of helped on one side for one group of workers and not so much for the others. So it was interesting that in the different industries, this sense of safety, which was so important to well-being, was derived from, different kinds of facets of the workplace. Although, both were really intrinsic to the workplace and were sort of under the control in some senses of the workplace. And of course, in the hospitals, they were dealing with incredibly changing guidance as well over what to be doing in terms of keeping health and safety. So maybe I'll let John, do you want me to let Jonathan answer as well? And then we'll come back to other things that were going on, or should I go on, Howard?
We'll go to Jonathan. Let me just ask you one clarifying question, though. You did comment on the term resilience and how you define it, but when you use the term well-being, can you just explain a little bit more what you're referring to, so everybody feels like they understand the broad
Sure.
context?
Yeah, that's a great question, because that word can mean lots and lots of different things. Generally, when we talk about worker well-being, we are thinking about psychological well-being or emotional well-being. So a sense that I have hope for the future, and I've got a sense of purpose, and I am generally speaking satisfied with how things are going in my life, and I've got kind of a experience a positive emotion. So the quality of my emotional life day to day is on balance, is positive. So we were really interested in sort of what are the factors that foster, enable workers to have a sense of well-being. And one of the things that was interesting, especially in the time of COVID, is that sense of purpose, which for a lot of people is really intrinsic to a sense of well-being. For the healthcare workers, that was something, they did feel a great sense of purpose and meaning in terms of the work they were doing was really important, but that had to be, in order for that to come through, they had to feel safe enough to go to work. They had to feel like, the system was caring enough for them in order for them to do what they needed to do.
That's great, Laura. And why this conversation today is so important to public health is oftentimes in the healthcare world, particularly, we focus on physical well-being, but aren't broad enough to really extend to emotional well-being and even spiritual well-being and psychological well-being. And you and your colleagues are trying to tackle all that right now. The attention on hope and purpose, and even flourishing, a term that our wonderful colleague Tyler Vanderweel promotes. So those are great comments. Jonathan, do you want to just also respond to the question, what worked well and what didn't in enabling workers to continue doing their jobs through the pandemic?
Yeah, a few things, and certainly related to what Laura said. One other piece is different people have different risk tolerance levels, and it's not necessarily by job. And you don't know often what somebody's risk tolerance level is until you're dealing with them individually, which makes it quite challenging. For us, what was really important to start was communicating. And one of our board members said, you need to communicate a set of guiding principles to get you through this. And the first thing was that we were going to try to survive the crisis because we didn't know if we were going to be able to do that. And we certainly did. The second thing was to maintain our standards for ethics and morals while we're achieving goal number one. And that was really important for people to understand what the boundaries were in terms of what we would do. And then do the most good for the most amount of people. So we couldn't save everybody, we didn't think, but we would try to do the most good for the most amount of people. And if I look back, my big mistake of what I did that didn't work well was this. We had this sort of internal argument that when we opened up is who should be back. Because the administrative people can work at home, the frontline people can't. And so should I go back? Should the president go back? I'm the CEO, we have a president. Should neither of us go back? Are we adding to the problem by bringing administrative people in? What's the fairness of all of this? And so I waited some amount of time, and you have the risk tolerance not only of the people in the company, but of my own family. Because now I have 3 kids at home working and my wife, who all at that point have something to say about it. And I eventually did go back. And I started by walking the factory floor and thanking everybody for coming in personally, looking them in the eyes and saying, I really appreciate your being here. And that was important. And then that turned into daily safety walks. And so I would walk the floor daily, and I called it closing all the mouse holes. So if I said there was a big board that we have and I'd write down anything I saw that was a problem, and it would be fixed by the next day, and people saw me doing this. And then once a week, I started bringing the senior management team, and sometimes I was tough with them and said things like, would you put your mother there? Because if you wouldn't, don't put them there. And again, it's setting guidelines and boundaries and very high expectations about safety. And people saw this, and I think they felt good that we were trying to do the right thing as we went through this, and everybody understood that it was imperfect. But setting expectations, communicating a lot, and being really visible as a manager and a leader to the people in the organization. And my big regret is not going back earlier, but I had never done this before, and I just didn't know.
Howard, can I make a comment? I think so relevant to that. So it's so interesting to hear Jonathan speak about that, because that is the number one thing we heard from all of our workers, regardless of which industry they were in, was the importance of management presence and support, and that that management was there, that they actually saw what kinds of things people were dealing with in their day-to-day, that they could express compassion and concern, but actually back it up with action, right? That they weren't just kind of emptily saying, oh, we're so sorry, we know this is hard, but they actually were kind of trying to figure out ways, to make it work. And, I just have this great quote from one of our CNAs who was talking about the fact that management had not been present in the beginning, and that they sort of didn't show up for a while. And they were sort of throwing orders and trying to tell people what to do. And the guidance was changing from moment to moment. And she said, she knew a bunch of 10 to 15 workers who left very early in the pandemic. And, this is a quote. She said, you would see these management folks and they're just throwing orders at you. This is what we're doing. Make sure when you come out of the room, you do this, blah, blah, blah. This is the quote. And then she said, it wasn't like they really cared. Like no one said, hey, how are you today? Do you need anything from me? I just felt like they should have been more caring as a human being, as a human, not a manager, a head director, or a CEO. So I just want to emphasize that, this is exactly what we heard, not only from our, hospital workers, but also from our retail workers who said, actually, one of the great things management did was show up, and that they felt like they had these relationships. So I do think that's one of our really important lessons.
That's great. Let's move on to a related question and drill down a little bit more on the emotional well-being, stress, and burnout themes. I mean, those are obviously front and center through the pandemic, and even now. Do you both want to comment about how much stress and burnout was experienced, how that was best addressed? Some of the communication themes you've raised obviously help in that regard. Walking the walk and talking the talk. You both have commented on that. Are there other practices that you've identified that should be continued in the post-pandemic world? And Jonathan, why don't you start this time?
Well, I will say to start on this that it is often the stress that people are feeling is often not visible to management, and it manifests itself in ways that one might not expect. And so you don't know. What we knew is that people had a fair amount of personal crisis going on, and it may be related to anything. It may be financial, it may be their own fear, it may be a family member being ill, it may be their housing situation, it may be their transportation situation. And one just doesn't know. And so the only thing that I can say about this is the need for flexibility. And the need for, it goes back to the need for communication to individual people to understand what might be going on in their life. And we would communicate to supervisors, managers of various levels saying, we have no idea what people are going through. You have to understand that this is a really difficult time for a lot of people, and we all need to be more understanding. And that, what more understanding is different for different people and for different departments. And so I'm not sure there's an easy, at least from my side, there's an easy playbook for all of this. Today we're all talking about going into a hybrid work environment. If you're a frontline worker, there is no hybrid work environment. If you're assembling something, you're not doing it at home anymore. For the last 100 years, I don't think we've done that. And there's going to be a lot of wringing of hands in about a year about the inequality of the hybrid work environment. And so we're going to have different stress levels for different, from different people for different things. But I think that we learned to be even more attentive to what was going on in people's personal lives and to bring that into the workplace and we tried to make resources available to people as we could. Well, we were also personally going through a difficult time and steering through some uncharted waters. So that's the best I can do with that.
That's fascinating, Jonathan. Thank you. Laura, you want to comment more on stress and burnout and how to address it?
Sure. I mean, stress and burnout was, of course, particularly an issue in the healthcare setting where, these folks are dealing with lots of concerns for their own safety, as well as watching a lot of really hard things in the workplace. And one of the particular challenges was in one of our hospitals where things were organized more hierarchically in terms of, the CNAs did this set of tasks and the nurses did this set of tasks, and they weren't really, it was, the hierarchy became more pronounced during COVID. So, the CNAs felt like they were stuck doing all the COVID patient care and COVID testing, where the nurses were like, well, we're only allowed to go into the rooms a few times because we can't, for safety reasons. And so it actually exacerbated some of the issues that were already present prior to the pandemic in terms of, lack of equity in terms of keeping people safe in the workplace and so forth. And so that was an issue that came up, whereas in the other hospital where there was a little bit less of this hierarchical organization and they were able to sort of create better team spirit and teamwork, where it felt like everybody was kind of working more together and there was this kind of separation of who has to be more at risk than not. So I think really paying attention to policies in how groups are organized and how the different policies affect the different groups and allow people to kind of stay safe at work, I think was definitely a really important lesson that came out of that. Again, on the retail and warehouse workers, the biggest issue for stress was economic precarity. So, just a sense of, I never know if I'm going to have enough work. I can't plan, I don't even know if I can pay my rent. I don't know if I need a babysitter. While that was all present prior to the pandemic, it was just completely exacerbated by the pandemic. And so there was just a real sense of, if there wasn't going to be kind of hazard pay or some way of promising people that they were going to get their hours, people felt really, really anxious about how they were going to navigate that set of issues. So I think those were some of the, the key issues that came up for our workers in terms of what was causing the greatest sense of stress and burnout. On the hospital side, what really helped was, again, these sort of bringing into play ultimately stronger communications by the management, a clearer set of guidelines for how things should go, as well as kind of a very integrated response to helping people to stay safe and stay well, which the employees really appreciated. Once those came up and running, they were very, very grateful, as well as, of course, the vaccine rollout. So I think that did help some, but it took a while for that to come into play.
Laura, thank you. Lots of questions coming in, so we'll be getting to those in just a second. But Jonathan, back to you. You reviewed a history where you've really spent a lot of time investing in your company in really substantive ways and your community, and built a lot of trust. You obviously depended on that through COVID. Can you just talk more about what's motivated you to do that, to serve on all these boards, to help out with all these public health and well-being issues in your community, and how that's reflected in your pandemic response and the response of your employees?
So when we first moved to Lawrence, it was, I would say, a new experience for me to experience a community like this. And what happened is I engage with our workforce, especially here from Lawrence, they're a really compelling group of people. And to some extent, it reminds me of, we all came from somewhere else. Certainly, my forebears came from Europe under very difficult circumstances. They came here, they were given a chance, and they were able to climb the ladder. Here, I had been involved in philanthropic efforts outside the city, and when I turned to look locally, I saw a really engaging group of people trying to climb that ladder. And the ladder is hard to climb any day, but it almost seems like the rungs of the ladder are greased now. And it's just very hard for people to climb. And there is a spirit here that I found very compelling. And so I started to engage, and the problems were interesting. The people were fantastic. I met a lot of really interesting people with unbelievable backstories. And as you start to understand the people and their backstory and what they've overcome, it's hard not to engage. And so to some extent, I think it was maybe a selfish endeavor to engage with some of these community institutions. I met a lot of interesting people with interesting problems. And we had a board member that had said to me once that trust is the basis of all relationships, between spouses, between a parent and a child, between friends. And we found that when you're trying to do continuous improvement in an organization, one of the things that gets in the way of that is that the workforce doesn't trust management to allow them to do something. They say, oh, I'm going to have this idea to fix something that's broken, and management's either going to ignore it or swat them down for pointing out a problem. And so what we had realized for a long time is that if we didn't build trust and do it in a tangible way, that we weren't going to move the company forward. And there's lots of stories I can take you through. We don't have time for that. But trust is one of our core values. It is, in fact, the biggest core value that we have as an organization. And it's how we get the most out of people, both for themselves and for the company, because those two things are really linked.
That's fascinating, Jonathan. That's great. So last question from me before we turn it over to the audience. So you both touched on many, many themes. So just to summarize, if you had to pick 3 top lessons from COVID, from your experience or your research, what would you convey as your top 3 themes to put forward to foster worker well-being moving forward? Laura, you want to start?
Sure. And actually, I want to pick up on a point Jonathan made, because I think it's so important, and we saw it so clearly in our interviews with our workers, which is that the investments that people made before the pandemic were very visible during the pandemic, meaning in the places where workers felt like prior to the pandemic, there was a lot of attention on supervisor support of the workers and communication, and a sense that supervisors really cared about their workers, and they were noticing if they were having issues or if there were concerns that needed to be addressed. Even though during the pandemic, the organization wasn't able to do some of the work that they had done to build that investment in terms of extra training for supervisors and so forth, that was still there. That sense of supportedness was still there during the pandemic because they had built it prior to the pandemic. So the workers were actually quite loyal and felt like people were really, paying attention, even when it got harder and many people were not on site and so forth. So, and there was more distance. So I think the combination of sort of investments when times are good, are so important, because they will, give you more latitude and flexibility when you're really, really facing challenges. And this particular issue of, supportive management and being present and having these relationships. So that's sort of probably my very top lesson. We did hear from all of the workers across the industries how important it was to feel like, they were supported. The other issue was workplace equity and letting workers have a voice, which is of course related to this kind of feeling supported by management, particularly among low-wage workers, where there's often a lack of fairness or avenues for airing grievances. It's really important to kind of look carefully at what are the issues that are going to create more equity, and what are the policies that even maybe not intentionally, but will somehow, sort of exacerbate inequity. So for example, in one of the hospitals, there were two different unions that were sort of trying to help the CNAs separately and the nurses separately, and they were not equally powerful, which meant that, different policies got implemented and exacerbated some of these, sort of inequity issues, even though of course everybody intended well. So, making sure workers have a voice and equity, I think, is going to be really important, particularly in this population of workers. And then the last lesson is the importance of economic stability. And I mean, I almost hate to say it because it's so obvious, but it's really, really critical. And those policies are not only at the level of the workplace, right? There's probably, kind of some federal policy and other regulation that is going to matter. But, if you can provide hazard pay or, give workers a sense of what this is going to look like so they can make their own plans for figuring out where things are going. I think those are sort of the top three lessons of issues that, enabled actually a lot of the workers that we spoke to were remarkably doing okay, right? Better than we would have expected, perhaps, when they were in these organizations that really seemed quite supportive. And I haven't spoken to Jonathan's workers, but my guess is many of them would sound, again, more okay than you might expect under these crazy, crazy circumstances of this year.
Thanks, Laura. Jonathan, you want to give us your top three lessons going forward?
Yeah, the first thing is communication and clarity of communication. And we communicated a lot. And the second thing is goals, making sure that people have a clear goal and understand where you're going and that they understand what their part is in achieving the goals. The third thing is thanks. We had tangible ways that we thank people, both me walking around and talking to people and the stuff that we gave them during the year, including hazard pay, including stuff. It's our business. And so we used it to thank people, and we sent stuff home to their families as well, including packets of PPE and all sorts of stuff. That's what we do. The last thing, the bonus round, is also, and we shouldn't forget this as managers, is how one takes care of oneself as you're undergoing a lot of stress. I mean, I gained weight during the pandemic. I would eat, but not even taste it during the, I would graze during the day. And you're so focused, and it was literally 24/7 for months, and very stressful. And, I just eating. And so you have to have ways to detox for the managers, or you're not going to be able to take care of the people in your organization as well.
Those are great, Jonathan. Thank you so much. Let's move on to some of the questions submitted from the audience. Here's one. Can you both say more about specific actions employers should take to help employees thrive as they return to work and move forward, hopefully past the pandemic over the next number of months? Just a couple of very concrete things. Who wants to start on that one?
I always worry about words like thrive, because again, in this organization, we have so many people with so many individual issues that we're dealing with, and a lot of times those are invisible. I think what we're doing now is we're continuing what we were doing before in terms of communication and in terms of engagement with people. And we're getting back to some of the things that we did before that give people a sense of more normal, while reminding them that what was before the pandemic is probably gone forever. So there is this sense that, we're not going back to what we had before. The markets are being reordered, supply chains are being reordered. This is now going to necessarily be different. Explaining that to people while doing things like getting our continuous improvement program, that train is right in the ditch, and getting the crane to get that train from the ditch back onto the tracks. So that continuous improvement in a lot of ways is about empowerment of individuals so that they understand that they have some control, and bringing back some sense of control to people, especially people on the front line, so that they know they own something and can control something, and that they're not just, a minnow subject to the whims of the tidal forces that are around them.
Thanks, Jonathan. And Laura, maybe to drill down a little bit more, here's a specific question on the same theme. Can you give some more details about what you mean by supportive management? I mean, that might vary by workplace, but what does that look like in a tangible way? And what actions and policies can make workers feel supported in a time like this?
Yeah, that's a great question. And of course, it is going to vary from place to place. I can tell you in our retail industry, the way they sort of implemented this was they actually had special trainings for manager to think about ways they could support workers. And that included things like being alert to mental health problems that might be arising or work-life challenges that people were having. They also selected managers who had good people skills. So a little bit of it was in the selection process. They wanted to make sure that they had people who were, kind of interested in talking to other people. They tried to create a culture of fun and sociality so that they were actually making work not only just, you have to get this job done and it has to be done in this way in this time frame, but that there were opportunities for the workers to come together around other activities so that you could build these relationships, sort of beyond just, I do this and you do that kind of thing. So it is going to vary from place to place, certainly in a healthcare setting, the way that you're going to build those things are going to be different than in retail. In the healthcare setting, there's some similarities though, which is kind of recognizing work-life challenges. And I think Jonathan mentioned this as well, right? People have lots of other stuff in their lives going on. So to the degree to which supervisors can be a little bit sensitive and flexible about some of those needs and, have the opportunities to say, oh, okay, we can change the schedule to accommodate, whatever circumstance you're facing is really important. So these relationships become so important. There's actually some really interesting work on the importance of relationships in different workplaces. If people are interested, that there's a investigator called Jody Hoffer-Gittel, Gittel at Brandeis. And she's got a lot of work where she looks at relational coordination and how you build some of these relationships in various different work settings if people are interested. So that's just a few examples. There are probably many more.
Can I add one thing to that, if that's okay? We're 86% vaccinated here in a city that's not 86% I don't know what it is, but I suspect it's nowhere near 86% vaccinated. And so one of the things is I spent a fair amount of my personal capital talking to people and dispelling rumors and myths about vaccines. But as I did that, I talked about my personal motivation. And I would say things like, I get paid the same if you get vaccinated. I'm just interested in your personal health, and save yourself, save your family. If you're skeptical, talk to your doctor about it. But also explain to people, we talked about goals, but also a little bit about motivations. And I opened myself in a way that I might not have done in a non sort of crazy pandemic way. And nobody has gotten upset with me that I know of. People have thanked me, even the people who were the crusty bunch who were having trouble, getting to consider a vaccine. We're getting them one by one. But the motivational piece and understanding that we're just looking out for everybody, that goes back to the whole trust thing that we built before. But that was another thing that we will probably take forward in some way.
Okay, these are fascinating comments from both of you. And Jonathan, to say more about the personal motivations comment, oftentimes people talk to one another about what they're doing, but not as much about why they're doing it and what drives them. And I completely agree with you. The more you talk about why you are doing it, you share more about your human story and your sense of goals and purpose and meaning, which people can really relate to, especially in a workplace. So that's great. And then both you and Laura have mentioned flexibility many, many times. I couldn't agree more. A reverend colleague of mine once said that it says in the Bible, "Blessed are the flexible, so you shall not be bent out of shape. So I often think about that in times like this. So we're getting close to the end. So let's maybe I'll wrap up, because I think I've heard so many fascinating themes, and then I'll turn it back to Vish. I think to first stress that well-being is much more than physical health. The mental well-being, emotional well-being, spiritual well-being themes are hugely important. I thought, Jonathan, the fact that you mentioned that stress is often invisible among our colleagues is a very, very insightful. We cannot assume a lot about other people, even people we work with closely every day. So being on guard for that is key and very, very important. Investments when times are good with supportive management. That's, you both mentioned that, but particularly you, Laura. The equity and fairness themes are really front and center in our country right now with respect to race and ethnicity in particular, but really applies to the workplace in terms of salary and working environment and wages. Laura, you stressed the economic stability. You mentioned the inability for some to pay rent. We have actually a homelessness initiative at our school that I'm very involved in. And we're all watching nationally the issues about evictions and eviction moratoriums that's going to expire at the end of July. So we got to follow that closely. The communication themes you've mentioned, both of you, are critically important. Saying thank you. I've had another colleague tell me that this is something that doesn't cost anything and that we should thank other people until it hurts. I've always remembered that and tried to do that. That can go a long way in a time like this. And then building a better culture in the workplace. That's what our Robert Wood Johnson grant that I've worked on with Vish and others is stressing on. Can we have private business and public health work closely together to build a culture of health and promote public health more broadly, especially in a time of COVID? So that would be my summary. And I really want to thank the panelists and the viewers who submitted questions. This time has gone way too fast. It's been a wonderful conversation. A lot to think about as we move forward and try to rebuild society in a critical time and rebuild well-being and public health for everyone. So thank you so much. And I now turn the program back to my good friend, Vish Viswanath.
Thank you, Howard. Talking about thanks, let me first thank you for doing such an outstanding job with this panel. I also want to thank Laura and Jonathan, for sharing their insights, both from the world of practice and research, on this very important issue. It is evident from the attendance and the number of questions that are being asked. There is a growing interest in this topic, a growing recognition of the importance of building resilience and the well-being of workers and employees. So as we navigate work coming out of the pandemic, more work will be needed, both in terms of research and practice, to understand the strategies that will maintain and enhance worker well-being and productivity in the workplace. We hope you will join us on August 17th for our next event in this two-part series, as we continue to examine the importance of cultivating well-being in the workplace. Our next event will feature two people, Pamela Heimel, Chief Medical Officer at Walt Disney Parks and Resorts, and Professor Glorian Sorensen, Director of the Harvard Chan Center for Work, Health, and Well-Being. The panel will be moderated by John Quelch, Dean at Herbert Business School and Vice Provost at University of Miami. They will discuss returning to the workplace as we navigate out of COVID and how we will apply the lessons learned related to worker well-being during the pandemic. So thank you again for tuning in. And once again, thank you to the panelists for your time and insights. Thanks.